Artificial intelligence and mental health care. How do they intersect? As technology rapidly evolves, its role in mental support becomes increasingly significant. We're in the heart of Amsterdam's Vondelpark to take the conversation on AI's role in mental health to the streets, and after that, we'll hear what an expert has to say.
AI, I don't know, they probably wouldn't know how to answer my questions properly.
I would have to know that they're using it the right way.
I don't think AI can feel like the compassion of a human.
We know from research that young people do enjoy talking to chatbots quite a lot. Also because they often feel shame to ask for help and to really go into a psychologist's office. At the same time, all these people, they mention empathy and human contact. And I think that's also very important to state that trust is very, very essential when we talk about AI in healthcare.
100%, like the accessibility, the easy access. I think it can be a step towards getting professional help from a real human, yeah.
Yeah, I think one of the benefits can definitely be that it takes away some barriers of seeking mental health care, especially for young people that might be afraid to ask for help or to talk to an adult. Then maybe it can feel safer to talk to a chatbot first and maybe later on decide to still go and seek professional care.
I feel like it's definitely quality that matters, not the efficiency when it comes to mental health. Even if it's a slow process, it's better to talk to a human than a chatbot.
She talks about that we shouldn't use AI to replace humans, and I think that's a very important comment because we often see that we use AI as a way to solve our problems with budget cuts, or we try to replace a personnel that we don't have at the moment, so we really try to solve human problems, and actually we should use it to enhance human capacities instead of replacing humans.
Yeah, I think there's always a privacy risk that information is being used for other reasons. Legislation and governments have a huge role to play there.
Yeah, you need to be sure as a patient that if you share very sensitive information about your private life, about your mental state, that it actually stays between you and the doctor, whether that's an AI doctor or not.
One potential risk I would see is obviously sometimes a human being can fail in expressing themselves correctly, or just in a way that if I would say something in a way that I speak, it could be perceived wrongly by the AI, and the human being would understand that way. AI probably wouldn't.
What he mentions here that relates to the problem we see with biases. These chatbots, they're developed for a specific audience, and they often are developed for the, let's say, average patients. But that doesn't mean that everybody who's talking to that chatbot will meet the criteria of this average patient. What he's mentioning with what if I use a different type of language or a different wording to express how I feel, will then the AI be able to help me as well? And I think that's a very fair point he's making, and also something we see as a concern.